All right, why don't we go ahead and get started? Welcome to Medical Grand Rounds, to our folks here in person on the second floor of where are we? Medical Sciences Building, I believe, and to many people joining us online. I'm Bob Wachter, Chair of the Department of Medicine at UCSF, and we have, I think, a really interesting topic and speakers today. The title is Healing Together, Lessons Learned from Educational Leadership During Disruption. The disruption, of course, that we're talking about was the COVID-19 pandemic, which over the space of a couple of days completely transformed everything about our educational programs, and of course, and everything else, but put program leaders in a position where they had to be unbelievably nimble to fix the plane while it was flying, to do all sorts of things that they'd never envisioned doing. And I have to say, what we did at UCSF, I'm very proud of. I think it went about as well as could go, and yet was incredibly disruptive to our trainees, obviously to our patients, but also to our educational leaders who had to grapple with all of these circumstances that they had never planned on and prepared for. And so we thought it'd be worthwhile reflecting on the lessons learned during the pandemic. And one of the lessons really was we had to completely change the nature of our training programs, including how trainees got together, and the relationship between trainees and program leadership invariably was tested. And so that's really what we're going to be talking about today, how it was tested, how we did, and what the lessons learned are. In some ways for preparation for the next terrible thing. Hopefully we will not see that in our lifetime, but also were there lessons learned that are actually relevant to us as we've moved out of the pandemic and onto a new stage. So the first is Rebecca Berman, who is our residency program director, has been in that role for how many years now? 6 years, having spent the early part of her career at both Mass General and Brigham and Women's Hospital. She was the program director of the primary care program at Brigham and Women's before we were thrilled to recruit her to run our very large and extraordinary medicine residency program. Rebecca is also the founder of the Crimson Care Collaborative at Mass General Hospital, a really influential care delivery organization that she put together. And I should also mention that as of last week, Rebecca is the Kanu Chatterjee Medicine Residency Endowed Chair. Those of us of a certain vintage will remember Kanu Chatterjee, an absolutely revered cardiologist and extraordinary teacher who was here for many years and trained many of us, not only in cardiology, but in how to be a great teacher. And it's really thrilling that we were able to raise the resources for an endowed chair for our residency director in medicine, which Rebecca now holds. So Rebecca, let me invite you to come up and look forward to the talk.
First impressions matter. And my first impression of life as a doctor during intern year was so unpleasant. I think it's going to be an uphill battle for years trying to revise my relationship with medicine and find some joy in my work. That was a quote from one of our residents who graduated about a year ago, which was collected by Julia Chambers in an effort to think through what were the experiences of the residents who trained in COVID. And as a residency program director, it was really, really sad to hear, and allowed me to really think through what happened to those residents who trained in COVID and how can we help them. So as many of you know, I'm the residency program director here at UCSF. We have 185 residents across our 3 hospitals, which span city, state, and federal bureaucracies. And I've observed that among many of our graduates who are now young fellows and young attendings, there feels like there can be a sense of mistrust. Mistrust in medicine, mistrust in us as an institution. So what happened? When I talk to residency program directors across the country, this is not unique to UCSF. This is something that was seen across the country, not only in medicine, but as we'll see in other residency programs as well. And while many generations of residents have had disruptive things happen, epidemics during their time, there was something about COVID, both in terms of the social isolation, and the larger kind of cultural shift around the centrality of work that made training in the pandemic particularly challenging. And so I wanted us to spend some time today thinking through what happened to help, what are the roots of this mistrust to help us figure out a roadmap to improve how we can work together to improve medicine, both for these trainees and for all of us. So as I wrestled with the challenges of supporting residents through the pandemic, I thought back to my own training. When I was a resident, I would go to the res room in the middle of the night and like talk through hard cases with my colleagues. I'd go to grand rounds with my friends. I remember it as this time of incredible personal growth and learning. It was hard. There were really long hours and some things that now we recognize are really unacceptable. There was widespread harassment and discrimination. We did lots of things that physicians aren't necessarily needed to do, like drawing blood and pushing patients down to go get their CT scans. But we learned an incredible amount. I had great mentors, I made great friends, and I learned a ton. Now think about the experience of that class that recently graduated. For them, the pandemic happened days before match day. They did match day online. All of their fun fourth-year plans were canceled. Those trips they'd planned, the time with family. Orientation, which traditionally has been a series of parties where you make lifelong friends. I see some of our interns in the crowd now, and they got to do this where you make lifelong friends during orientation, but this group didn't. Instead, they maybe met on the beach, distanced, masked for a few minutes, and then they went off to their team rooms, isolated in their team rooms, trying to keep themselves safe, trying to take good care of patients. But they never really got to bond as a class, and they never really recovered. When community-acquired COVID infections decimated our ranks, leaving us short-staffed, the faculty came into my office and said, "What's going on with the trainees? I feel like they're not as committed to learning. It feels like they're just clocking in and clocking out. Why does it feel like they don't trust us as teachers, as educators, or as an institution?" To understand the roots of this mistrust, we need to hearken back to March 2020. I remember the week of March 7th, just across the street, 100 leaders across UCSF learned disaster planning. We're all breathing the same air, thinking about what would we do in this theoretical thing if the world closed down. And then 1 week later, we were in shelter in place. Everyone was making disaster plans. And in those original disaster plans, the house staff featured prominently. They wanted our house staff to staff the ICUs and the wards and the new respiratory care units. And we as educators were trying to protect our residents, making sure there was enough PPE, keeping them safe from this novel virus, and helping them cope with this new sort of shift to isolation. And our partners across UCSF were amazing. We kind of agreed that our house staff would cover the ICUs and the faculty would take care of the wards, COVID wards, and the COVID respiratory care units. And we had to pivot on a dime in terms of our educational conferences. None of us really knew how to do virtual conferences, and suddenly everything was virtual. We tried to use breakout rooms in the chat to get people to engage, but as all of those of you who are watching online and multitasking as I speak, you know that it's just not the same. The buzz in the room that you get of a great clinical reasoning conference is not the same online. And it's no surprise that our residents opted to skip conference so that they could get out early. Learners were just trying to adjust to the new normal. Without as much joy, where conferences were not this like spark of excitement in their day, they just were trying to get through the day, to take great care of patients and get out of the hospital and try to take care of themselves. The camaraderie that had bonded generations of residencies together, helping folks through this fundamentally challenging time, had weakened. As an educational leader, I struggled to hold the community together. Virtual socials quickly lost any appeal for anyone. And institutional policies here prohibiting food long after society had opened up made it really hard to get residents together outside of work. There's only so many bring your seltzer water to the park socials that people want to go to. And the program's inability to kind of pay for food and foster community really paid a toll. And every institution had its failures despite the best of intentions, right? At Stanford, they didn't vaccinate their house staff early. Across the country, programs didn't get PPE to their trainees early. And here, I would say it was a failure to pivot, to sort of keep up our policies with society as it changed. And trainees then didn't feel like we as institutions had their best interests at heart. There's a fundamental reduction in autonomy that comes with residency, and that became a lot harder to swallow when they no longer trusted our institutions. When young physicians stand up to the status quo or try to reflect how things could be different, it's really important that we listen because they're trying to push us to make medicine better. For me, a great lesson in this came in the spring of 2020, right after George Floyd's murder and our national reckoning with structural racism, when I got a really heartbreaking letter from our Black trainees, and they asked me to do better. They asked us to diversify our faculty, diversify our residency leadership, to figure out systemic ways to evaluate our rotations and our faculty for mistreatment and racism. And you know what? They were right. I could do better. And we as an educational team have worked hard to implement their recommendations, and our residency is still not perfect, but I think it's a lot better. And I really appreciate them for stepping up and telling us how we could do better. It's a great reminder that the fresh perspective of new eyes can really help shed light on where we as a profession can improve. So how do we revive our educational culture? As the residents in the room know, we have been working on this with laser-like focus for the last several years. We've improved our mentorship, built community events, and really tried to bring our educational culture back in person. So thank you to those who are sitting here in the audience today in person, because we realized that that time together, that spark, that joy is what makes work fun. Our medicine residency had actually received a work hours citation in 2019. So concomitant with the COVID pandemic, we were actively shortening the hours that our residents worked. And so we kind of answered the question, does working less bring joy? And it turns out it's not just about working fewer hours. It's really about having joy in the workplace when you're here. And what we're doing is working. Yesterday, I actually had a really heartwarming conversation with Kaveh Dinesh, who's one of our interns. It was a holiday. It was Indigenous Peoples Day, so we did not have conference. And he was saying how he was really sad there was no conference because he looks forward to that hour of learning and socializing and just taking a pause from the work of taking care of patients. So how do we together support these young physicians to help spark joy? Prior literature on well-being amongst healthcare professionals talks about the importance of communication, of transparency, and of allowing people a place to voice their opinions so that we can hear their ideas. And of course, supporting their physical and mental health. I would argue that maintaining relationships is the number one thing that we as individuals can do to reduce moral injury and to help kind of rekindle that joy. So using these lessons, here are 3 ideas of things we as individuals can do to help our young colleagues heal from the impact of learning in the pandemic era. The first is to have empathy. Yes, we all worked long hours when we trained, but this generation just had it harder. The second is to commit to engaging in person. If you have a mentorship meeting, show up in person. Don't do it over Zoom. Bring the fellow to the bedside or come to our conferences. We have conference every day in M989 here in Parnassus. We have in-person conferences at the General and at the VA. We would love to have you. And I will say it fills your bucket as a faculty member as well. It's fun watching these brilliant minds kind of grow and stretch right in front of you. And then the last idea is to listen to their concerns. When our young colleagues question the profession, they're trying to make us better. Let's try to step back and listen and see if we can see things from a new perspective. That's how we've improved lactation policies and parental leaves. So let's help us all improve the profession together. Thank you.